Come along to KPMG HQ on Athol Street today, talking with Courtenay again, which means biomeds.
Yep.
We asked you to update us, and you certainly do that.
Yep.
And it's an exciting development as always. But what's going on today?
We've got another cluster meeting, so every 2 months we have those. And today we've got 7 individuals, that's 3 professors and 4 PhDs from Manchester University, looking at what we might do collaboratively with them, perhaps to be more nimble in some ways or to help startups get funding. So it's a collaboration with a big university.
Okay, well, we've lined up 2 to talk to today. Tell us about our first guest.
Yeah, Professor Tony Whetton. He's involved at the Christie Hospital and an expert in leukemia and blood cancers. And we're here to see how we might look at a research policy or an institute. It's early stage, but let's see where this goes. So Tony is here as a collaborator and open-minded to work with us.
Well, I've been to the Isle of Man before, and I see huge amounts of potential for interactions between the University of Manchester and the Isle of Man. I think there's a great positivity here for improving healthcare and also for generating new ventures around, well, precision medicine and biopharma industry. And so I want to talk to people about developing those links further.
And has it been interesting getting together with other people then?
Oh, absolutely.
Yeah.
Absolutely. I mean, the thing is that we're moving into an era of precision medicine, and precision medicine involves teamwork. The favourite quote I have about this is, you can't pull bits and pieces together and suddenly have healthcare be better. You have to create an ecosystem where you can do innovation. And I'm really interested in the Isle of Man being part of a greater ecosystem which will involve University of Manchester and the NHS in Manchester, which is probably going to undergo a devolution process and have its own £6 billion budget.
And how far are we away from seeing something happening?
Well, as I say, we've already established the Manchester Centre for Precision Medicine, and as such, we've got those foundation stones in place. We know what needs to be done. Speaking to people on the Isle of Man about whether they want to engage with us about taking those building blocks and erecting their own edifice on our building blocks is what we're about today and in the future.
So that's Tony and what he's got to say. And our second guest.
Our second guest is Professor Paul Townsend, and he is involved in business engagement, so looking around the world for best ideas where Manchester University and their brand, their 40,000 students can be plugged in around the world for business engagement and in many ways better patient outcomes. So it's all around health.
Okay, so it's quite clear that the Isle of Man has could have a really unique position globally in terms of healthcare and healthcare provision. What we can do in Manchester through our Precision Medicine Institute, hosted by and headed by Tony, who you met earlier, we can show how to engage with patients, deal with patients and give them the right medicine at the right time, at the right dose and the right particular one. Industry are really keen on that because it focuses what they need, what they would like to do in terms of diagnostics and new pharmaceutical development. If you could use a fantastic ecosystem that the Isle of Man actually has, bring all that together, you will lead to something that is world leading.
And where are you up to at the moment?
So at the moment we've got a number of partners or stakeholders, as one wants to call them. We've got a number of industrial players of both large and small. We call them SMEs, small medium enterprises. And what we find with the smaller companies, you know, around say the 10 to 20, 30 employees, is they're very fast, very eager, very aggressive to kind of help. Everybody obviously, of course, wants to make money, but they want to help healthcare and help the future generations. We are living longer. The healthcare industry, the NHS, the government know this. We need to manage that properly. We are completely different between one another. Hence, we need what we call precision medicine. What a one-trick pony does not work anymore. We have to look at everybody individually, and industry are really keen on that as well.
How are you finding interaction with the Isle of Man government? Obviously, then, you know, having response to what you need is paramount. Has that been forthcoming?
It has. I mean, we arrived yesterday. We've met a number of individuals. We've met a few people today, and the engagement and the enthusiasm is really quite clear to see. You have the same issues and hurdles here that we see in the United Kingdom, that we see globally. We have to deal with those together. I think what you can do here, a bit like an SME, is you could do it faster and show the world how to do it.
And that's what Paul had to say. Now, I know you're getting all the different data centres together at something as well, going more excitement there?
There was, we've had that early this morning, so the cluster meeting at 11, but at 9:30 we had the 5 data centres here and Manx Utilities to look at what we might do around a biodata vault. It's early days. We want to understand what medical companies may want to come and trial here and how that data should be protected, kept private, and then can be translated into better, again, patient outcomes.
And what's the feeling like, though?
Feeling is it's a big ask. There's lots of regulation around the world. There's alternative jurisdictions, there's HIPAA, there's compliance, there's data protection. So lots of areas where what are the steps we need to understand from a customer viewpoint and what can we do to differentiate ourselves in terms of our community and really getting them to act as one. We're a small island, but we've got 6 data centres with 5 data companies.